Good day everyone, my name is Kyle, and today I will talk about movement terminologies. But first, what is movement? Movement or motion is the change in direction of an object relative to a fixed point. The movement terminologies that I will discuss to you are major body movement terms and some special movements that occur at the synovial joints. Synovial joints are the most common types of joints in the human body. They typically connect two bones, usually in the limbs, and they also provide mobility to the human body. So now, sit back, relax, and watch and learn. The first two movements are flexion and extension. Flexion or bending is a decrease in angle between two joints as they bend or move closer together, while extension or straightening is an increase in the angle between two joints as they straighten or move further. Remember that flexion and extension are always in sagittal plane, which separates right and left parts, and also antagonistic movements, which means these motions oppose one another. The next movement is hyperextension. Hyperextension is an abnormal or excessive extension of a joint beyond its normal range of motion. The next movements are abduction and adduction. Abduction is a movement away from your midline in the coronal plane, which separates anterior and posterior, or in simple terms, front and back. While adduction is a motion towards the midline. Here's a tip. In abduction, just remember that the keywords are move away, and in adduction, you are adding the body part towards the midline. Like flexion and extension, abduction and adduction are also antagonistic movements. The next movement is circumduction. It is a special movement and an angular movement that blends the motion of flexion, abduction, extension, and adduction to create a circular or conical motion. To remember the movements, just remember the acronym FABEA. The next movement is rotation. It is a movement term that describes a bone moving around a central axis. For you to better understand, isipin mo yung screw tas iniikot mo siya either pakaliwa o pakanan gamit screwdriver. The next movements are medial and lateral rotation. Medial rotation, also called as internal or inward rotation, is a rotation that moves the body towards the midline, while lateral rotation, also called as external or outward rotation, is a rotation that moves the body away from the midline. Keep in mind, when you are rotating the arm or thigh, the anterior surface of that body part will be your focal point, and if you move that part towards your body midline, it is medial rotation, and if it is moving away, it is lateral rotation. Ano? Kaya pa ba today? Kaya mo yan, konti na lang to, promise. The next movements are pronation and supination. Pronation is the rotation of radius, a lateral bone in forearm, in medial direction or going towards the midline, while supination is the rotation of radius in lateral direction or going away from the midline. Para mas maintindihan mo, pronation is parang may kukunin ka ng pera, while supination is parang nanlilimos ka. The next movements are dorsiflexion and plantar flexion. Let's start with dorsiflexion. The keyword to this word is dorsal, which means backside. In this movement, the backside of the foot moves towards the shin or the bone in the leg. Dito, para ka mag-uunat ng paa pag bagong gising ka. Next is plantar flexion. Plantar means the sole of foot. The sole of the foot moves forward the calf. Dito naman, parang magtitingkad ka habang naglalakad. The next movements are inversion and eversion. Inversion is when the soul turns towards the body midline, while eversion is when the soul turns away from the body midline. The next movements are opposition and reposition. Opposition is the movement of the thumb toward the surface of the palm and then the thumb meets the tip of one of the fingers, while reposition is when the thumb and finger return to original position. The next movements are protraction and retraction. Protraction moves the body part forward, while retraction moves the body part backward. The next movements are elevation and depression. Elevation refers to a movement of a body part moving upward, while depression refers to a movement of a body part moving downward. Ito na, last na tayo, yay! The last movement is lateral flexion. It occurs when your vertebral column bends to the side.